we're diving into a topic that's transforming the way healthcare practices grow and thrive: the digital front door. In a world where convenience and technology reign supreme, staying ahead of the curve isn't just about embracing change, it's about survival. Patients today expect seamless, efficient interactions with their healthcare providers, and the costs of not keeping up with these expectations can be enormous, financially, reputationally, and even in terms of team morale. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Healed Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 113, The Digital Front Door, Optimizing Online Presence for Patient Growth. Welcome to today's episode of Medical Money Matters. We're diving into a topic that's transforming the way healthcare practices grow and thrive: the digital front door. In a world where convenience and technology reign supreme, staying ahead of the curve isn't just about embracing change, it's about survival. Patients today expect seamless, efficient interactions with their healthcare providers, and the costs of not keeping up with these expectations can be enormous, financially, reputationally, and even in terms of team morale. Let's start by exploring the costs of falling behind. Imagine this: a patient tries to book an appointment with your clinic. They navigate a clunky website, struggle to find the right contact information, and after 15 minutes of frustration, they give up and move on to another provider who offers online scheduling. You've just lost a potential patient before they even step through the door. These kinds of inefficiencies add up, and over time, they can erode your practice's bottom line. But it's not just about money. Practices that rely on outdated processes often experience a cascade of negative consequences. Staff members become overwhelmed, trying to compensate for inefficient systems with manual workarounds. Morale dips, turnover increases, and the overall patient experience suffers. A disorganized practice leads to longer wait times, missed follow-ups, and dissatisfied patients who are quick to share their negative experiences online. All of this feeds into a vicious cycle. Poor technology leads to poor experiences, which leads to bad reviews, which leads to fewer patients, and ultimately stagnation or decline. Now, let's talk about what happens when you flip the script. What does it look like to make your interactions with your practice Amazon easy? Think about why Amazon has become such a ubiquitous part of our lives. It's not just the selection, it's the ease of use. You can find what you need, place your order, and track it in real time, all in a matter of minutes, or sometimes even seconds. The healthcare equivalent of this experience starts with simple, intuitive technology that streamlines the patient's journey from start to finish. One example is online scheduling. Imagine patients visiting your website, selecting an available appointment time that fits their schedule, and confirming their visit with just a few clicks. No phone calls, no back and forth, just efficiency. Pair this with automated communication, like appointment reminders sent by a text or email, and you've already eliminated some of the most common patient pain points. Another critical piece of this puzzle is the patient portal. A well-designed portal allows patients to access their medical records, test results, and even communicate with their healthcare teams securely. It's about empowering patients to take an active role in their health while reducing the administrative burden on your team. And let's not forget telehealth. The pandemic accelerated its adoption, and patients now expect to have the option to consult with their providers virtually. A user-friendly telehealth platform can make your practice more accessible, especially for patients who face barriers like distance or mobility issues. Some practices are already leading the charge in this space. For example, there's a primary care clinic in California that's using AI-driven chatbots to pre-screen patients before their visits. The chatbot collects basic information, triages symptoms, and even suggests appointment types based on the patient's needs. By the time the patient arrives, the staff has the majority of the information they need to provide personalized care. Another standout is a dermatology practice in New York that allows patients to upload photos of their skin concerns through an app. A dermatologist reviews the images and provides a preliminary assessment within 24 hours, cutting down on wait times and improving patient satisfaction dramatically. These practices exemplify the core tenets of a tech-enabled clinic: accessibility, efficiency, data security, and integration. Accessibility means making sure your digital front door is open to everyone, whether they're accessing your website on a smartphone, tablet, or desktop. Efficiency is about reducing friction at every step of the patient journey, from check-in to follow-up. Think of how many clicks it takes to get what you want from Amazon. Your patients would love that kind of digital efficiency. Data security is non-negotiable. Patients need to trust that their information is safe. And integration ensures that all of your systems, from electronic health records to billing, work together seamlessly. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future podcast episodes downloaded as soon as they're released. Now, let's take a moment to talk about the impact of these technologies on patients and your team. Patients are often delighted by simple innovations that make their lives easier. A practice that offers digital forms for check-in, for instance, saves patients the hassle of filling out paperwork in the waiting room. Automated reminders reduce no-shows and help patients stay on top of their care. And when payments are easy, with options for online billing and automated payment plans, patients are more likely to settle their accounts promptly. From the perspective of your team, these technologies can be game changers. Staff members spend less time on administrative tasks and more time focusing on what they do best: providing care. This not only improves morale, but also enhances the overall efficiency of your practice. A streamlined operation means fewer bottlenecks, better resource allocation, and ultimately a higher standard of care for your patients. Of course, transitioning from tech mediocrity to a fully tech-enabled practice doesn't happen overnight. It requires a clear roadmap and a commitment to change. The first step is to assess where you are today. Conduct a digital audit of your systems. What's working? What's not? Gather feedback from both your staff and your patients to identify pain points. Next, prioritize your investments. Focus on quick wins that deliver immediate value, like implementing online scheduling or upgrading your website to be mobile-friendly. At the same time, think about your long-term goals. Maybe you want to adopt AI tools for patient triage or integrate remote patient monitoring for chronic conditions. Whatever your goals, make sure you allocate a budget and timeline for each initiative. Once you've identified your priorities, it's time to implement them. This step is critical, and it's where many practices falter. Change can be daunting, but with the right training and support, your team can adapt. Start small, rolling out changes incrementally to ensure a smooth transition. Monitor your progress and be prepared to make adjustments along the way. Finally, measure your success. Track key performance indicators like patient satisfaction scores, appointment adherence rates, and operational efficiency metrics. Use this data to refine your approach and ensure you're meeting your goals. Now, some of you might be wondering, what about older patients? Will they embrace these technologies? The answer is a resounding yes. Baby boomers are increasingly tech-savvy. They're shopping online, using social media, making travel arrangements, and managing their finances through apps. Healthcare technology is no different. By designing user-friendly interfaces and offering support during the adoption phase, you can ensure that even Medicare beneficiaries feel comfortable using your digital tools. The result? Higher patient engagement across all demographics. When patients see a practice that's modern, efficient, and tech-forward, they equate it with high-quality care. It builds trust, enhances loyalty, and positions your practice as a leader in the industry. In conclusion, the digital front door is more than a metaphor. It's a gateway to growth, efficiency, and patient satisfaction. By embracing technology, you can transform your practice into a well-oiled machine that delights patients, supports your team, and drives long-term success. So take that first step. Conduct a digital audit, prioritize your investments, and start building the future of your practice today. In the digital age, a tech-enabled practice isn't just a competitive advantage, it's a necessity. Front Office Revenue Cycle Education, an in-depth course on the impact your front desk has on your clinic's bottom line. This online, on-demand, 2-hour course is led by seasoned revenue cycle experts who will teach your front office staff the importance of obtaining accurate patient demographic information, how to effectively collect money at the front desk, and their impact on the life cycle of an insurance claim. Available now online for $195 per person at www.healtheps.com under Courses and Force. Enroll your front office staff and watch your denials go away.